A prospective study of tuberculosis in Uganda prisons showed an annual incidence of active TB to be 955 per 100,000 persons per year, with prisons increasingly becoming breeding grounds from which infection is transmitted to the general population, accounting for up to 25% of a country's TB burden. A project run by the government in 3 jails in Uganda shows that tuberculosis can be fought successfully in detention facilities.
What we have gone through in the last 5 years is a great transformation from a system that is rudimentary to something much modern that has served for the benefit of the inmates, staff, and the neighboring community who actually access services, because the quality of services they do get from the prisons is much better than even at an outside health facility.
The project has resulted in increased cure rate for TB, a drop in the number of malaria cases, and HIV/AIDS mortality rates lower than among the general population. In prison, the incidence of all 3 conditions are normally much higher.
When we were brought here, we have been advised on HIV/AIDS. We could go for the HIV counseling and testing, and the services here provided freely.
Launched in 2012, the government initiated the project, and by the end of 2015, the number of inmates infected by TB diminished for the first time ever. The treatment success rate, which went from 63.1% in 2009 to 86.3% in 2012, also improved significantly in comparison with the national average.
The risk of not continuing with the TB treatment is that you are at a risk of death, you are at a risk of developing multi-drug resistance TB, which is a bit very expensive to manage in our country.
The challenges, however, is ensuring the prisoners stick to the treatment plan. Penitentiaries in Luzira, Fort Porter, and Gulu, success rates for the treatment of tuberculosis exceeded targets set by the Ugandan Health Ministry, 75%, and by the World Health Organization, 85%. The mortality rate remained relatively stable, while the incidence of malaria dropped by 76% between 2009 and 2015. New practices introduced were quarantining and testing all new arrivals for TB, HIV/AIDS, malaria, and other conditions. Segregating those with TB and directly observing them taking their pills to ensure they complete the treatment and don't develop multi-drug resistance TB. Improving TB patients' diet to boost their immune systems, offering voluntary HIV testing, follow-up care, and peer-to-peer counseling are some of the measures. Prison laboratories were also upgraded with better diagnostic and testing equipment and could operate around the clock owing to a regular electricity and water supply. Tuberculosis is an infectious bacterial disease caused by Mycobacterium tuberculosis, which most commonly affects the lungs. It is transmitted from person to person via droplets from the throat and lungs of people with the active respiratory disease.